First up, I just want to do the macro, if I may, and your thoughts about global birth rates here in the U.S. What have you seen in your practice about what's going on and what you see as kind of some of the main reasons? Is it complications in getting pregnant? Is it older age? What do you see from your vantage point?
I think it's a variety of things that we're dealing with. Part of it is young people feeling less certain about the world and less certain about their financial futures and being more reluctant to have children. Part of it is being in a place where in much of the world, we do have choice about whether or not to have children. I think a lot of it is financial, though, unfortunately.
Well, yeah, I mean, we can open up a whole discussion about like what different governments could be doing or should be doing in your view to help encourage this. But I feel like at least in the United States, the idea of a dad or a mom being able to spend an extended period of time with a newborn is still a luxury. And I wonder to what extent that is something that holds people back.
I think that's a huge factor, especially here in the US. We are one of the very few industrialized countries that doesn't have a standard set of parental leave. You still have to ask it as a favor in a lot of places. And even though we do have FMLA and people are obligated to give that leave, it's only certain companies. It's not necessarily paid leave. And that makes a huge difference in people feeling whether or not they can afford it, both in terms of finances, but also in terms of their ability to connect with their child and their emotional bonding with the child.
Okay. Again, here's another thing that I'm going to get hate mail. But if guys were having babies, do you think this would be different and that we would have figured this out?
Oh, you've asked a great question. I'm sorry to say I do think it would be different if guys were having babies. I think a lot of the place we're in has to do with just a lot of preconceived ideas about what motherhood is and the self-sacrifice that mothers have to make and the fact that half the population isn't going through that experience.
So let's go to that. Having had a child and just loving actually the whole process and being very lucky because I know it's not always so easy. And I know it can be difficult just getting pregnant. It can be difficult through the process. It can also be difficult afterwards. We know women get postpartum depression. Give me an idea of how common that is.
So it's surprisingly common. It's about 15 to 20% of the population in countries like the US and other industrialized countries. So when you think about it, it's much more common than a lot of other relatively common disorders. And yet it's very little talked about, studied, or recognized.
Why? Or is it just because we're women?
A part of it is because we're women, and I think we don't prioritize women's health. It was only in 2014 that the National Institutes of Health required science that is doing research in animals to use female animals in addition to male animals. So we're really far behind in terms of the research we have in women's health. We're far behind in terms of the advocacy that we need to get to the answers of why people develop postpartum depression and what kind of supports we need. One of the statistics that I find so shocking is that there's that 15 to 20% rate of postpartum depression, but the rate of women that we actually diagnose and treat is much, much lower than that, with only about 3% of women with postpartum depression are actually treated to remission, so treated until they get better.
How does that treatment typically work, doctor?
So there's a variety of things that we can use. Fortunately, we have a lot of good and evidence-based treatments. We just don't always put them in place where we need to. So there are a couple of different types of psychotherapy that are evidence-based for depression, in particular cognitive behavioral therapy and interpersonal therapy. We also know that traditional antidepressants are efficacious in postpartum depression. And then we also have some relatively new drugs that are based on hormonal mechanisms that also have some good evidence for treatment in postpartum depression. So we have the treatments, we're just not getting the moms to the place where they can access them.
And I guess in an ideal world, right, it would be great if you could predict if someone is going to likely have it. Is there something to it? And my understanding is that you're researching biological markers that could help predict postpartum depression. What are folks looking for? And I'm just wondering how this could maybe be a game changer for a lot of women.
Yeah, I do think it is a game changer because, as I said, we have good treatments. We just don't get women to the place where they need to get them. And part of that is that we're not sure who's at risk. Postpartum depression is something that can be caused by many different factors, both psychosocial factors and biological factors. But if we had a blood test or something that could really predict who's at risk, we'd be able to target the resources we have toward those moms who need them the most.
Yeah, look, I think this is something too, increasingly that partners are understanding, and in a world where, dads, the non-birthing partners have an understanding of this, they can increasingly be a supporter or play a role of support. How does that partnership factor in your work and in recovery?
I think that's a huge factor. One of the things that we know is a huge contributor to postpartum depression is sleep deprivation, which is common with a newborn. But I increasingly am seeing partners, non-birthing partners, who are really willing to invest that time to get up in the middle of the night and help the baby. And that can be such a support and can be a prevention of postpartum depression for the mom. We also, unfortunately, can see postpartum depression in the non-birthing partner. Yeah. So it's really a situation where the two partners have to support each other.
It gets us back to the idea, Carol, of having that flexibility and being lucky enough to have a job where you can actually, be away from work to spend that time at home.
I just got to do a shout out for my husband because he, on that and getting sleep, would do a nighttime feeding at midnight so that I could at least kind of get 4 or 5 hours of straight sleep. And that was part of our routine.
And he still cooks dinner for you every night too.
We can't forget. He does cook dinner.
Okay.